This is Detroit's Morning Answer with John Anthony on FM 92.7 and AM 1400. The Answer.
Mr. Smith, what law did Republicans pass that throws 15 million people off their health insurance? That's the accusation that was made a few minutes ago.
It's a great question. I've been setting up here listening to the testimony, Madam Chair, and it is unacceptable that people are not being honest. And not being honest with the American people, because whenever you say that Republicans removed the subsidies, that's a complete lie. It's not false, it's a lie, because those subsidies were created solely by Democrats, and they chose to make them temporary in the American Rescue Plan and in the Inflation Reduction Act. They set the sunset for the end of this month. You know why they set the sunset for the end of this month? Is because they spent all their money making permanent environmental tax benefits for their wealthy donors instead of the American people, and that is just a fact, Madam Chair.
Thank you very much. I think you're being very generous in what you are saying here. I also understand that a comment was made that there is only one way for Americans to access affordable health care, and that is through a discharge petition that has been introduced.
That was Representative Jason Smith sitting in a congressional hearing. You know, health care is one of those issues everyone talks about, everyone pays for, and almost no one really fully understands it. We hear slogans about affordability and access. You can keep your doctor if we won't know what's in it until we vote for it. Yet these costs keep rising. The choices, they keep shrinking, and Americans keep feeling like the system works for everyone except them. Our guest today understands healthcare from the inside out. Dr. Nan Hayworth is a board-certified ophthalmologist who practiced medicine long before entering public life. She served as the U.S. representative for New York's 19th Congressional District and has remained a leading voice on healthcare policy ever since. She currently serves on the board of directors of the Independent Women's Forum and is chairman of conservAmerica, where she focuses on patient-centered, market-driven solutions to America's healthcare crisis. Dr. Hayworth has treated patients, written policy, and watched firsthand what happens when government intentions collide with real-world medicine. Today, we are diving into healthcare subsidies, who created them, who ended them, what happens if they expired, whether Obamacare can be fixed or must be replaced, and President Trump's idea of sending healthcare dollars directly to the American people instead of through insurance companies. Dr. Hayworth, welcome to Detroit's Morning Answer.
It's a privilege to be with you, sir. Thank you.
And thank you so much for serving, and thank you so much for just informing people. We don't have enough people out there who can articulate a lot of these real hard, tough issues, and I really appreciate. I knew who you were when Riley told me that I was interviewing you, and I was like, that's formal. She said because she introduced you as doctor. When she said your name, I was like, no, that's Congresswoman. I remember her.
Well, you're very kind, sir. And a simple Nan will do. We're all in this. We're all in this together.
Yeah.
And the short response, sir, is that President Trump is right.
Yeah.
Americans need to be able to make their own choices and control their own health care dollars, and it can be done.
Yeah. Well, I'm going to tell you it's going to be hard for me to not call you doctor or congresswoman because I'm a former cop, and it's hard for me to not use titles to address people. So I'll do my best. How about that?
I have such respect for you, Mr. Anthony. You have no idea. I was privileged to represent a lot of members of the New York Police Department when I served in the House, and it was one of my most cherished aspects of my responsibilities.
I love it. Now, okay, Nan, when
Yes,
people hear the phrase healthcare subsidies, most
yes.
people have no idea what it actually means. What are the subsidies under Obamacare that were extended twice? How do they
Yes.
function, and who qualifies for them today?
Well, it's a great question. So right now, today, there are about 22 million Americans who qualify for these so-called subsidies. And they are subsidies, and a subsidy is a payment that is made with taxpayer money to anyone in American life for any reason that the Congress deems appropriate or necessary. In the case of the so-called ACA subsidies, those subsidies go not to Americans themselves, those 22 million Americans who qualify for them, but to insurance companies directly.
Yeah.
Okay? So the problem, one of the many problems with that, and there are problems with all of this, but one of the many problems with that fact is that we know now, thanks to the Republicans in Congress, that billions of dollars of these subsidies have gone to insurance companies for so-called enrolled patients, if you will, enrolled individuals who don't exist or are duplicates or triplicates or quadruplicates of people who already have insurance. So that's part of the problem. But the bigger issue is that American taxpayers and American premium payers, and that's basically just about all of us, are being hurt by the fact that the terms of the so-called Affordable Care Act, which was a lie, right?
Yes.
Everything was a lie about it, and Republicans said it at the time that Democrats made it the law. You're not going to be able to keep your doctor. You're not going to be able to keep your hospital. You're not going to have the same kind of coverage at an affordable price that we all want you to have. But in any case, these subsidies are paying for insurance plans that have heavy requirements that pump up the price of the insurance plans.
Yeah.
To give you an example, and then John, I'll stop because I know there's more.
No, you're doing good. You're doing good.
Oh, thank you, sir. Well, to give you an example, I have a friend who is a young man. This is a real life story. Who purchased a plan on an Obamacare exchange, and he is single and he is male. He had to pay in his policy for pediatric dentistry, in other words, for children's dentistry, and for maternity care.
Wow.
Yeah.
He may. I'm sure he doesn't identify as a woman, right?
No, that's right. No, he definitely does not. I know, John. I was thinking the same thing with the Democrats. It's like, yeah. Sadly, you could say that too. But no. So the reason they did that, and by the way, this is the fallacy and the danger behind the so-called Medicare for all type proposals, is that then the government, Congress, and the regulators can load on all these burdens on us that don't make sense in real life.
Right.
And just add to the cost. And why are they doing that? Because all of that money that goes to the insurers then is used for the priorities of effectively, the lawmakers who did this and their constituencies. So American insurance companies have been loving Obamacare because they've been making tons of money. Now, I appreciate that we need an insurance industry and we need a healthy insurance industry. So I get that. I really do. But what we've been asked to do in Obamacare is the people who buy Obamacare policies the money and whether or not they're subsidized, obviously, a lot of this money is not subsidized. It comes right out of their pocket.
Right.
And when your insurance now costs $24,000 a year for a family of four, how the heck in this climate, in this economic climate, is anybody supposed to afford that?
Yeah. But Nat, here's my question, though. Before we even can answer those questions, don't we have to answer this question? Was the Affordable Care Act, the so-called Affordable Care Act, was it a bill about health care, or was it a bill about health insurance? Because it sounds like health care was not really addressed in this bill. This was more about health care insurance, correct? Am I wrong? Am I off?
No, John, you're not wrong. And mostly it was a bill about transferring massive power to the federal government to confiscate from us, the taxpayers, and us, the premium payers, and direct the money to their favored constituencies. And America's insurers and the pharmacy benefit managers made sure in the writing of that law in 2010 that they were going to be made more than whole.
Wow.
And that's a problem.
Wow. So what's going to happen? I'm sure.
I know.
What's going to happen in the Senate? Because I think I know what's going to happen in the House. I think Mike Johnson is going to be able to pull something through with the House members. But what's going to happen in the Senate? Now, we know these subsidies expire at the end of December. If you have to put out and say, this is, John Anthony, this is what's going to happen January 1, what is it?
Yeah. Well, John, I have a feeling, sadly, and just for everybody, your listeners are well informed, so I'm sure they know, but just in case, the big problem that you're alluding to is that most of this type of legislation needs 60 votes in the House of Representatives. So the Republicans have about 52, 53 votes, I think, at this point. That is not 60.
Right.
So they would actually have to have at least 7 Democrats go along with them, and that's going to be a tall order.
Filibuster?
So, yes. Well,
should he end it?
Exactly. And here's why I predict that that the Democrats will vote to continue the misery, because they did it during the government shutdown, right? And they did it because of this issue. They know they've got, their favored constituencies, especially, and again, I want a healthy insurance industry, but especially the insurance industry, pharmacy benefit managers, all the people who want Americans to be on the hook for paying them lots of money for things that may not fit their lives and typically don't and could be done better. But I think the Democrats are going to hold out and they're going to say, look at the misery that the Republicans are causing. The clip at the top of your show was perfect, right, of Chairman Smith saying this is what they're doing. They want to accuse the Republicans of making Americans, poorer and sadder and, not have the right insurance coverage. And, John, I'm just going to point to a model from the state I grew up in, Indiana, your neighbor.
Yes.
And in the state of Indiana, Democrats and Republicans got together. This was when they had Governor Daniels, so this is going on like 20 years ago.
Yeah, I remember him.
And he's great governor, and they got together and they created an option for folks who received Medicaid and for state employees. Okay, so those two groups were given health savings accounts, which is what the Republicans in the House and Senate want to give Americans overall. They were given health savings accounts, their own money with a subsidy. There was subsidy going into these savings accounts, and they could choose from a variety of plans what worked best for them. And it was a great success. It can be done. And Democrats are the only people standing in the way of doing this for all Americans.
If you're just joining the show, we're talking to Dr. Nan Hayworth. She's a former New York representative, congressional person, I should say, New York 19. When President Trump has floated this idea of sending this health care dollars directly to the American people. My question becomes, how does he get around Congress to do so? And how is this different, you just mentioned it, from the health savings account or tax credits?
Yeah, no, well, what I'm talking about is basically that, and the Congress does have to make it happen.
Correct.
The president cannot do it single-handedly, and I think he's awesome, and I wish he could, but he can't. Yeah, he can't. Through no fault of President Trump's, he cannot do that.
Yeah, but Dr.
So, and every Republican in the House and the Senate stands ready to do this. This is exactly what they want to do for Americans, so that they will have insurance they can afford, insurance that fits their needs, whatever their age is, whatever their medical challenges are, plans that are tailored to them at a price they can afford, and they get to keep the dollars in their account.
Yeah.
If they happen to choose plans, like a younger person, for example, can choose a plan that's more like a catastrophic plan. A lot of people like that. I will pay for my own small expenses. And by the way, John, the other part of this is that to your very astute question about, is this health care or health insurance? What are we doing?
Yeah.
There is a big movement in health care for price transparency and for offering people a menu of choices. If you go to a hospital and you need an X-ray, there are places there are providers in this country who will do it for, say, $25 or $50, depending, as opposed to the bill you're going to get from the hospital for $5,000 for an X-ray. Obviously, I'm making up these figures.
Yeah.
But these weirdly inflated, distorted prices, and it's all because of the mess that's been made in American insurance, and it affects the quality of our health care directly, of course, but the mess has been made by governments meddling in the relationship between patients and the people who provide their care.
Yeah, Dr. Hayworth, we got about 2 minutes and 40 seconds left. Just imagine we wouldn't have this whole headache if, and God bless him, and may he rest in peace, if Senator John McCain hadn't stood up on the Senate floor and gave us the thumbs down. We would have been able to gut and replace the Affordable Care Act. But here's another question. Here's my last question for you, because you always hear this. Now you're a leader with the Independent Women's Forum.
Yes, sir.
How do you respond to claims that conservative health care reforms hurt women?
Oh, no, it not in the least, because women, number one, women tend to head up households in terms of making these kinds of decisions, and they can fulfill their own needs as well as those of the families for whom they provide and care far better if they're treated as intelligent people. And again, pointing to the state of Indiana, folks who received Medicaid and folks who were state employees, all were able to make smart choices for themselves when they were given the opportunity to have their own accounts into which supportive dollars could be placed, and their own dollars, right? You could have a subsidy into them, and you could put your own dollars in there. To do anything else treats us as, which is what the modus operandi of the Democrat Party tends to be. Americans aren't smart enough to they literally feel this way, right? We're not smart enough to deal with things on ourselves. We're not smart enough to make these choices. Oh, and by the way, if we make them for you, we're going to be able to make a lot of very big entities very happy, which helps us maintain our political position.
Ooh. Dr. Nan Hayworth, let me tell you, and they do that with every identitarian group, every victim group. Yes. They all,
yes,
you can't do, but we government, we can do for you. My goodness, that'll preach. Let me tell you, that'll preach.
Thank you, sir. You are so right.
Where can people find you? And I got to have you back on. I definitely got to have you back on.
I would be honored.
Where can people find you, reach you, if they want to learn more about the issues that you are out there? And I really do hope that this administration is reaching out to you for your advice and your experience in this matter as they move forward. Where can they find you?
I have enormous confidence in this administration and the amazing people who are in it. several of whom I know pretty well. But I'm at Nan Hayworth, just at Nan Hayworth on X, and I post there all the time and would be honored to have your listeners come and say hello.
I really appreciate it. Nan, or I'm going to say Dr. Nan Hayworth, thanks so much for joining us today on Detroit's Morning Answer.
Thank you, sir, and thanks for your service.
All right, you're the best.
You too.
Wow. I just love having conversations like that. I really do. And she's amazing. Amazing. Fearless. We'll be right back.